Welcome back. Today we have Dr. Brad Thompson with LeBauer Healthcare at Grandover Village. We're talking about the importance of health screenings and those routine checkups. So let's review just a few things on our wellness checklist, starting with adults and needing just that annual checkup, that wellness visit.
So yeah, historically people have said, well, I only need to go and see my doctor just once a year, if even that. That's a very important time. That's where we tend to focus on a lot of the preventative things we earlier, cancer screenings, looking for risk factors for heart disease. Again, it's nice to just come in and touch base, but really it's a good time for us to make sure overall health is being maintained.
Okay.
Um,
Go ahead.
Oh, just again, emphasize those, talked about those screenings earlier. Other things to consider, again, are blood pressure, just how you feeling, talk about smoking, just a lot of those things that we just want to make sure you're doing well.
All right, now some people are guilty of not taking their prescribed meds like they should. Maybe they're confused about how and when to take them, or they're concerned that, that they maybe are taking too many, pills in one day, that kind of thing. How concerning is that? What do they need to do to make sure that they're getting back on track?
So sometimes having to take a medicine every day can be hard to remember, uh, depending on what the condition is and what the medicine is. It's hard to say, if you miss one or two, how important is it? But on a whole, if it's being prescribed, and would like you to take it. That being said, it can be difficult to remember all the time. So I think it's important to maybe check in with your local pharmacist. Cone Health has multiple community pharmacies, and just check in with your doctor just to make sure that you're on track. If you're having trouble prescribing it, maybe there's something we could do to kind of adjust it as needed.
Okay. And we know as the kids have been heading back to school, like getting them a good night's rest really makes them really successful for the day, and they get really cranky if they do not get enough rest. But mom and dad, sometimes they skimp on their own sleep. So what should adults aim for, and what are the do's and don'ts when it comes to getting a good night's rest for an adult?
Sure. Getting good rest is important for good health. The recommendations are roughly about 7 to 8 hours per person, though it does vary based on each individual. Some things that we can do to make sure we get a good night's rest is staying off of our smart devices close to when we go to bed, making sure we have a regular routine where we go to bed at the same time and get up at the same time, and avoiding things like stimulants such as coffee or tea later in the afternoon. Those things can really help people get enough sleep.
I'm curious, is there anything different, like for getting a good night's sleep, that's different for men versus women?
Women tend to need maybe a little bit more sleep than men do, maybe a half hour or so. But again, it really varies between person to person and what their needs are. Again, we're really happy to address it in our office visits if you're having any issues kind of going forward.
All right, so adults need to work on their stress levels. What are some of the health risks of too much stress on adults? And then how does that show up with us that maybe we're not being very aware of?
So, this is a really stressful time. I have kids that are going back to school right now, and, schedules are up and down and trying to meet job demands. Life is always moving. So stress really can weigh on a person. Sometimes they feel it, sometimes they don't. It can manifest as symptoms of even regular heart rate or maybe elevated blood pressure where they don't feel it. And there can have a lot of downstream effects, again, affecting blood pressure, weight gain, and other diseases kind of moving forward. So it's real important to try to get a check on stress levels. Again, making sure you're eating right, exercising, and if you're having ongoing issues, even while you're trying to make those adjustments, again, we're happy to see you and make sure there's not something else going on.
Okay. All right. So we're talking about all different kinds of screenings and precautionary things, some that are new, like that heart calcium one, and also the lung cancer screening. Thank you, doctor, for joining us today. We're going to make sure that we have all of that information for you to easily get to. You're going to want to look in the To Your Well-Being section of our news.